When you've been fully vaccinated. How to protect yourself and others. These recommendations can help you make decisions about daily activities after you are fully vaccinated. Have you been fully vaccinated? In general, people are considered fully vaccinated when they are 2 weeks after their second dose in a 2-dose series from either Pfizer or Moderna, or 2 weeks after a single dose vaccine, for example, Johnson & Johnson. If you have not met these requirements, regardless of your age, you are not fully vaccinated, which means keep taking all precautions until you are fully vaccinated. What can you start to do if you are fully vaccinated? You can resume activities that you did prior to the pandemic. You can resume activities without wearing a mask or staying 6 feet apart, except when required by federal, state, local, or tribal or territorial laws, rules, and regulations. If you travel within the United States, you do not need to get tested before or after travel or self-quarantine after traveling. You still must pay close attention to the situation of international travel. You do not need to get tested before leaving the United States unless your destination requires it. You still need to show a negative test result or documentation of recovery from COVID-19 before boarding an international flight to the United States. You should still get tested 3 to 5 days after your international travel. You do not need to self-quarantine after arriving in the United States. If you have been around someone who has COVID-19, you do not need to stay away from others or get tested unless you are exhibiting symptoms. However, if you live or work in a correctional or detention facility or a homeless shelter, or you've been around someone who has COVID-19, you should still get tested even if you don't have symptoms. What you should continue doing, even if you're fully vaccinated. You still need to follow guidance at your workplace and other local businesses. If you travel, you should still take steps to protect yourself and others. You will still be required to wear a mask on planes, buses, trains, and other forms of public transportation traveling into or out of the United States. And when you arrive in the U.S., you will still be required to take a test before you can return to the U.S. after international travel. You should still watch out for symptoms of COVID-19, especially if you have been around someone who is sick. If you have symptoms of COVID-19, you should get tested and stay away from others. People who have a condition or are taking medications that may weaken their immune system should talk with their healthcare provider to discuss their activities. They should continue taking all precautions to prevent COVID-19. This is what we do know. COVID-19 vaccinations are effective at preventing COVID-19 disease, especially severe illness and death. COVID-19 vaccinations reduce the risk of people spreading COVID-19. And this is what we're still learning. We're still learning how effective the vaccines are against variants of the virus that can cause COVID-19. Early data shows that the vaccines may work against some variants, but could be less effective against others. How well the vaccines protect people with weakened immune systems, including people who take immunosuppressive medications. And we're still learning how long COVID-19 vaccines can protect people. We're still researching, and as we know more, the CDC will continue to update our recommendations for both vaccinated and unvaccinated people.